All right, we are recording. You guys ready to get going? Let's do it. Okay. Now, I will tell you that I have the chat up in the corner, but a lot of times I don't see it until we're done at the end. But there's going to be time at the end for question and answers. So please plug your questions in the chat box. You can send it to me directly or also to everybody in the Zoom, whatever you feel comfortable with. We are going to, I'm going to start by just kind of saying that gonna give myself an introduction. So I am Kat. I am a doctor of physical therapy, and I specialize in all things pelvic health and all things obstetric or pregnancy postpartum type things when it comes to physical therapy. I definitely, oopsies, hello. I definitely deal with a lot of people who leak with exercise, just leak in general. So I'm super excited to be talking to you guys about this tonight because it should never happen. We're going to talk about why it does happen and what you can do to help. But it is so common. So I want, if anyone's on here that like wondering, they're like kind of feeling embarrassed or anything about leaking, please don't. It is one of the most common things that goes wrong with pelvic floor dysfunction and super prevalent. So excited to enlighten you guys a little bit more about this. Okay, I'm gonna try to do these clickers on my keyboard, but we'll see if it lets me. All right, so, okay. So a lot of people think, wait a second, isn't leaking kind of expected if, like I had a baby, I'm getting older, like my mom and my grandma leaked. I just did a really freaking good workout. Like, of course I leaked. Or maybe you're rushing to the bathroom, like, oops, can't make it all the time. So a lot of people are like, wait, shouldn't that be expected? And honestly, it should really never happen. So the main answer is no. Leaking is extremely common, but is never considered normal. You are not abnormal if you are leaking, but that it should not be happening. Just think, prior to maybe you ever experiencing leaking, you weren't leaking at some point. Most people in their life can recall a time where they didn't have leakage. Some people have had leakage since they were children, but that's a lot more uncommon. Most individuals can relate to a time in life where they weren't leaking, and that's really how we should be living our lives, not worrying about having to wear black leggings or having to empty all the time just because you're afraid of leaking. That is all considered abnormal. So just to make you feel a little bit better too, there's a lot of different studies that are out about kind of incontinence, and there actually still needs to be a lot more, but about 4 to 35% of women experience leaking with exercises. It kind of seems like a wide range, but a lot of the studies either just do people who've never had children and female athletes. Some do women who've had children, so it really varies. One recent study and overview actually showed a mixed study of those who haven't had children and who have had children, and the incidence of leaking with exercise was between 43 and 48%, and I think the sample size was like 400 and something people. So that was a huge study, and it really showed how prevalent leaking with exercises, especially when it comes to higher level activities. There's several studies on CrossFit-like activities too. Some of those indicate, 30% to 50% of people experiencing leaking with CrossFit. So you do have an increased chance to leak if you have one or more risk factor, or you participate in high intensity exercises or CrossFit style. So leaking with exercise is, or like exertion, is called stress urinary incontinence. There are several types of incontinence. A lot of people are like, wait, isn't incontinence when you just like lose everything? I don't have incontinence. Actually, if you even leak one drop of urine or gas or stool, that is considered incontinence. So when we leak with exercise, that's called stress incontinence. Other types of stress incontinence include leaking with coughing, laughing, sneezing, anything where there's a big increase in pressure and that you experience leakage, that is considered stress incontinence. So what are the risk factors for incontinence? So pregnancy and childbirth, both vaginal and cesarean. So you do not have to have only had a vaginal delivery to experience any sort of leaking. A lot of people are they're confused like that. Like, what? I didn't have a vaginal delivery. How that's related? Yes. So any sort of pregnancy is related. Also, increased parity, or how many children that you have had. So the more children you have, the more likely you are to have incontinence. Aging is a risk factor, prolapse, constipation, diabetes, and high BMI, obesity. These are all things that might make you more likely to have incontinence. But incontinence just does not mean this is normal to have. These are just things that give you a little bit more, you're more predisposed to experience it. So why do I leak with exercise? Like, what's happening there? So it is unique to each individual, but basically a few common symptoms or reasons are usually that your pelvic floor muscles are weak. Your pelvic floor muscles might be too tight, leading to weakness. We'll talk about that. You have poor pressure management in your abdomen, or you have poor pelvic floor muscle coordination. Maybe you have the strongest pelvic floor in the world, but if it's not turning on at the right time, you might experience leaking, or if it's not coordinated. And then positioning and posture while you're doing your exercise, usually that is a secondary kind of reason behind it. Typically, it goes along with having a weak or too tight pelvic floor. So let's talk about the pelvic floor first. So if you have never heard of it, no worries. If you have, I'm sorry, I hope I don't bore you. But the pelvic floor muscles are a set of muscles that are located inside of our bodies. They are in our private parts area. And these muscles form like a bowl at the bottom of your pelvis. So I'm going to show you, you can see in this picture here, but I'm also going to show you on my anatomy model. So here is the female pelvis. And here's the pubic bone in the front. Here's your spine in the back. These are your two side hip bones. These are the two butt bones that you sit on when you're sitting in a chair. So everything in red are pelvic floor muscles. There's a ton of them, okay? Now I'm gonna zoom in kind of into the vaginal area. So right here we have our rectum, we have our vagina, and then we have our urethra. This is where we pee from, this is where we leak from. Okay, now I'm going to kind of turn it this way. Do you see how they form a bowl? So these muscles are really, really important for support and stability. These muscles have several jobs, four main jobs. One being they control your bowel and bladder function. So they help you hold in your pee and poop, and they help you release your pee and poop. They also, like I just said, are supportive and stabilizers. They're a part of your deep core. They are also really important in sexual function too. But we're not going to get all into that today. We're going to talk mostly about the leaking with exercise. But these muscles are super important. They are really pretty much the main driver when we're having any sort of leaking. So what can you do to help? Like, cool, thanks so much. But like, what do? I'm leaking. I want to stop leaking. I want to like wear other leggings and not feel embarrassed or afraid to go to my workout class. So let's do some gentle exercises. So I'm going to walk you through a series of 3 different exercises. We are going to go through first how to activate your deep core. Then we're going to go through how to relax your pelvic floor. And then we're going to go through how to contract your pelvic floor or do a kegel. I'm also going to do a little anatomy instruction throughout each one, just so you can really relate it a little bit more. Just in the nature of webinars, I don't even know if I said this in the beginning, but remember, this is just educational content. Use it as you can, but it's really hard to specifically address the exact, for me to exactly know that you're doing right. So I usually like to show you the anatomy so that you can really feel confident that you are at least doing it mostly the right way. It's hard to teach on a webinar, but most people can kind of get the gist. So first, let's talk about how to properly engage your deep core. So this picture to the right is a picture of a side view. So this is your spine. This is the front of your tummy over here. This is a muscle called your transverse abdominis, which is what we are going to learn to activate right now. But there's 4 major muscles to the core. A lot of people think that their abs are their core. So when you do core exercises, you're doing abdominal exercises. So your abdominal muscles, yes, are located in the core region. However, your core muscles are actually more deep stabilizers. So I call these muscles the bra of the spine. Why do I say that? Because if we were to go for a run, our lady friends might, without a bra on, our lady friends might be moving more than maybe we'd want them to. So we wear bras to kind of give support and give stability to our boobs. And basically these muscles kind of do the same thing to the spine and pelvis. So when they are activated, they give support and stability so that you can move and groove and do your exercises and day-to-day function. So the muscles really include the transverse abdominis, which is this one here. This one's called your multifidus. This is your diaphragm up here. and then your pelvic floor is at the bottom. So we kind of have like a 360 little doming of muscle support in this area, and they all have to coordinate together to have proper function. A lot of these muscles are also anticipatory muscles, meaning that they actually are working before you even want them to or know they're working. And a lot of times, which we'll go through in a little bit, that can be the problem, is they're not firing and turning on at the right times, leading to leaking, etc. Now, let's talk about how to deeply engage your core. So, like I said, these muscles are like the bra of the spine. They do not really cause a lot of movement. What they do is they actually prevent a lot of movement. So this is not going to feel like a big or clenching or anything like that. This almost feels like you're doing nothing. I promise you, less is more. For you to really truly activate your deep core, you should not feel a ton of movement. You should not feel a bunch of clenching or tightening. You should really feel more of a gentle activation. That is true core activation. So let's kind of talk about how we do that. I want you guys to think about the spot like right below your belly button where your pants would tie or where you would button your pants. So that kind of lower abdominal area, I want you to think about that little motion that you would do if you were about to button tight pants. Some people do this, like imagine that they're going to pull their two bones in the front of their hips, those sharp bones in the front of their hips. Imagine using their muscles to pull them together. But basically, it works best as you exhale. So let's all just take one nice deep breath in. And as you exhale, I want you to gently kind of pull that lower abdominal area towards your spine, almost like you had a string behind your belly button and that area, and it's going to slightly pull back to your spine. I'm going to lower the camera so you can see on my tummy. So kind of looks, I'll go to the side too so you can see. So as I breathe in, as I breathe out, I'm just kind of activating, gently pulling in this lower area. We don't want to see you grip or suck in or bear down. We want to think about slightly activating, almost like we're buttoning tight pants or putting on, or zipping up a zipper, some people like, or trying to gently pull these bones together. Some people, those are really common cues at work. So we want to take a breath in, everything relaxes. We're going to exhale, slightly bring that area in. It's really subtle and really small. It should not feel like a big pull in. So that's how we properly engage our core. And it's going to be important for later when we kind of put this all together. Any questions about that? Throw them in the box. Okay. Now, all of this is really similar. So what we just kind of did is going to relate to a lot of this. So how to relax your pelvic floor. These pictures are a little confusing, but I'm going to walk you through this. So if you can see up here, this is our trunk, like we were cut in half. If you can see, this muscle here is called your diaphragm. You can also see it on this model. It sits underneath your rib cage. It forms that dome at the top of your abdominal cavity. Your pelvic floor muscles are these. They're not shown in this picture on the left, but these are your pelvic floor muscles. They form a dome at the bottom of your abdominal cavity. So these muscles quite literally work in synchronization when we're doing breathing. So the way that we relax our pelvic floor muscles is through a technique called diaphragmatic breathing. So why do we need to relax our pelvic floor muscles? So earlier I mentioned that a lot of times you can be leaking because your pelvic floor muscles are too tight. So tightness in muscles is not necessarily a good thing. Typically, tightness in muscles leads to weakness because the muscle is not working at its best capacity. It's tight, it's cranky, and that leads to weakness because it's not really able to do its full job. Kind of think about too, like imagine your bicep, if you were to do bicep curls and you just were to keep squeezing up here, the muscles are too tight. So we need to learn to relax our pelvic floor so that we can get really good, nice, good strength there. So how do we relax our pelvic floor? Through diaphragmatic breathing, and it's due to anatomy and pressure. So I kind of use my model to help show. So we have a bowl at the bottom of our pelvic region, and then our diaphragm sits at the top. Okay, so when I inhale, my diaphragm actually drops downwards, and that increases pressure in my abdomen. That increase in pressure forces the pelvic floor muscles to lengthen. So when I breathe in, diaphragm drops down, pelvic floor lengthens, and it reduces tightness here, which can really help when we're dealing with leaking, because a lot of times our muscles are already way too tight and these muscles are not able to fully relax. Therefore, they are having weakness. So when I inhale, our pelvic floor muscles drop down, my diaphragm drops down, my pelvic floor muscles lengthen. So let's try to practice this. I want you to go ahead and just get to a comfy seat. If you're laying down on like the couch or something like this, I want you to bring like your knees towards your chest, kind of into like a little kind of this position, like knees to chest, or relaxed, or your feet up on the couch. But I want you to try to feel that area between your sit bones. That's where your pelvic floor lives. So here are your two sit bones. Your pelvic floor muscles are in the middle here. So when you're sitting or wherever you're at, I want you to be aware of your rectum and vaginal area. I want you to close your eyes, and I want you to try to take a nice deep belly breath, thinking about breathing into your rib cage and that area where your pants button and tight or button. So as you breathe in, you want to feel that lower body expand, and you might feel how your pelvic floor muscles, or that area between your sit bones, kind of goes downwards a little bit. So let's try that again together. So you're going to breathe in. I want you to close your eyes, focus on that area between your sit bones, breathe in, feel how maybe something moves. If it's hard to feel, it's really subtle, but if you feel any sort of expansion, pressure, downward movement, that is pelvic floor muscle relaxation. So actually, if you don't feel it, it's okay. So what we really want to make sure you know how to do is diaphragmatic breathing. Diaphragmatic breathing is more of that chest and belly breath versus, or excuse me, that rib cage and belly breath opposed to a chest breath. So when you are doing diaphragmatic breathing, you want to think about your rib cage going outwards as you inhale, your belly going outwards as you inhale, not breathing with our chest. So let's try a few together. So we're going to breathe into our hands. We can bring our hands to our ribs if that helps you feel it. So breathe in and feel your belly and ribs expand, and exhale. Good. Let's do two of those. One more. Exhale. Last one. Breathe in. Exhale. Good. And just let your exhale be passive. But the more you get better at this, you might be able to sense that little bit of downward movement in between your sit bones. That is your pelvic floor muscles relaxing. So we need to be able to relax. Most of us need to be able to relax our pelvic floor muscles. A lot of times people think, oh my gosh, I'm leaking. I just have to do a freaking ton of kegels and strengthen down there. I must be like, everything must be not, no, nice and tight and strengthened, which typically is actually the opposite of what we typically train people to do at first, because a lot of times people's muscles are way too tight. Remember, tightness leads to weakness. So we actually, the first step to healing incontinence typically is to teach relaxation, and then we go to strengthening once your body's able to coordinate properly. It is hard to know what your body specifically needs, but everybody can benefit from relaxation of their pelvic floor. We all need to learn how to do it. So it is something that is also really important when it comes to leaking with exercise. And we're going to go through some of the reasons later, but I want you guys to know how to do it. So how do I relax my pelvic floor? Diaphragmatic breathing. Another little quick way to relax your pelvic floor is to imagine that you are about to let yourself start the flow of urine or pass gas, like secretly, like a silent but deadly one, and you're about to like pass gas. That little just gentle downward movement, super small, that is pelvic floor muscle relaxation as well. We never want to push down, we never want to strain down. We want to always just be using our breath to cause that. Okay, we can go over this again in the Q&A if that's still confusing, but basically we need to relax the pelvic floor muscles if we are leaking, most likely. Now, I am going to teach you guys though, how to properly do a kegel. Now, I don't take this lightly because I am like not a fan of kegels. However, that's because most people are way too kegeled and they've just been told like, hey, do 100 kegels at every stoplight. And hey, like just what, whatever you can, just do kegels. Like what other muscle do we train like that in our body? Do you do like 700 bicep curls a day? No. Imagine also that if my pelvic floor muscles are too tight, and I just like my bicep was too tight and I just kept doing bicep curls, it doesn't go anywhere and it leads to more tightness and dysfunction. So I need to be able to relax to get a full kegel. So I'm going to teach you how to do one, but the most important thing is the relaxation part of this, okay? And also less is more. So you don't need to be doing this giant clench. It should be a little activation, and the focus is on the let down. So how do I do a kegel properly? About 80% of women are shown to actually not know how to properly do a kegel. So you should not feel your butt cheeks clench, your abdominal muscles clench. You might feel a little bit of activation of that deep core muscle when you do a Kegel. That's normal. We're going to talk about that a little bit. But you should not feel anything really be moving. It should really be isolated to the pelvic floor muscles. So there's some cues that work. Bear with me. Some of them are kind of weird, but the imagery really helps. So I want you to picture your pelvic floor muscles, all these in red, okay? And the muscles around your vagina and rectum. So we are going to try to imagine that we are going to stop the flow of gas or urine. Really just imagine. That is how you properly do a Kegel. Now, if you don't feel that, other little cues, some people will picture like there's a blueberry or a bean at the vaginal or rectal opening, and we want to just try to gently pick it up and then gently place it back on down. So we don't want to be like clenching and squeezing. We want to think just activate, lift, and then let it back down. If you don't feel the letdown, likely you're dealing with some pelvic floor muscle tightness. If you don't feel the activation, likely you're dealing with some pelvic floor muscle tightness. Sometimes it is weakness too. The best way to know is to have a pelvic exam. But for Kegels, they can be very helpful for a few different reasons. So yes, they can help strengthen the pelvic floor. I use them more for coordination, getting the muscles to turn on when they're supposed to. We're going to go through something in a few slides that is about timing and coordination. So you could have a rock solid pelvic floor strength is like through the roof, awesome. But if it's not timing properly, you're going to likely experience some leakage. So yes, Kegels are important, but they are much more utilized for coordination versus like just building a bunch of strength. So if you're doing tons of Kegels, I want you to go ahead and put those on hold unless you've gone to pelvic floor physical therapy and your therapist that do these Kegels. Otherwise, don't do them. I don't care if your OB told you to do them, your GYN. They are not able to assess the muscle function as accurately. And also, typically, you do not need to be doing these high reps of these Kegels. Okay, not that your OBs and stuff don't know, it is just not their area of expertise when it comes to muscle function. Okay, let's go ahead and talk about some tips and tricks for leaking with exercise, why we are here. Sorry for the background, all that stuff, but it's really important so that you can understand why this might be happening and what we can do to help. So pressure control. This is a huge one, especially with high intensity interval training and also CrossFit style exercises. So pressure in our abdomen, right? So we have a pressure in our tummy. It's called your intra-abdominal pressure. So a lot of times we're leaking because we are not managing our pressure well. So you could have really strong muscles and whatnot, but if they're not being activated at the right times, it can lead to improper pressure. More pressure here leads to more downward pressure in the pelvic floor, which gives you a more increased likelihood to leak. So I want you to imagine, like if I were to, squeeze a icing, like icing out of whatever the icing bags are. But when I squeeze at the middle, it comes out the bottom, right? Because that puts downward pressure. So we don't want to always be activating our core massively, like we just squeezing our core preemptively while we're running. We really just want to kind of let our body do its thing. Now, another thing is that you do not want to hold your breath during exercise. We should always be maintaining your breath. And a lot of us are kind of like, yeah, well, no crap. I try not to hold my breath, but sometimes I have to. It's my exercise. If you have to hold your breath during an exercise, that is like the first little flag that that exercise is likely too challenging for your muscles and your stabilizers, so that you are having to use your breath to try to give some sense of stability. Typically, I recommend kind of modifying that exercise or trying to pair it with exhalation. So typically a nice, easy way to remember for pressure management is to exhale with effort. So exhale with effort. What does that mean? You breathe out during the most effortful part of an exercise. That can be different for every person. Some people, it's the squat down that is harder, or some people it's a squat up that's harder. You can exhale with any part of the exercise that feels like you need to hold your breath. That can really help manage your pressure in your abdomen. Also, exhalation activates, like we practice, that deep core stabilizer, which also in turn activates your pelvic floor. Your deep core and your pelvic floor are best buddies. They contract together. So exhaling with effort typically gives your body that right support to help during leaking with exercise. So really working on pressure control is huge. Another thing is with exercise, you really never want to strain or bear down. Now, when we're doing heavy lifting, yes, like a lot of times that is our first initial reaction to do, but this can really cause a lot of leaking and a lot of pressure in your pelvic region. So if you can, try to make sure you're exhaling during that really hard part. And if you can't, if you have to hold your breath, likely you might have like the global strength to do that, but likely you're putting a ton of strain and pressure through your baby stabilizer muscles that are trying to give you all that support that your organs and everything needs. So I'm not saying typically, and I'm going to go through this in a few slides about kind of how you can build up to that. But if you feel the need to hold your breath, try to either exhale or modify the exercise and work on that pressure control. Okay, posture and positioning really, really matters when it comes to leaking with exercise. So our pelvis, we have what's called a neutral kind of posture alignment. Posture is not, we're not meant to be these like rigid, perfect posture humans. Posture is dynamic, posture is always moving. So it is not like we have to be in this perfect posture. However, when we're doing exercises, our body positioning can deal with a lot of the forces that our bladder and our pelvic floor muscles have upon them. So when we are, if we are in a hunched position or we're in an arched position, this can change the alignment of our pelvis and our spine, which can lead to increased pressure and increased downward pressure on our pelvic region, likely leading to leaking. One of the most common mistakes is a rib flare. So what do I mean with a rib flare? Most commonly, a lot of women especially flare their ribs outwards. They jump by flaring their ribs outwards like this, or some people are kind of rounded and jump like this, that increases pressure. So we want to be somewhere in the middle. So I usually have you kind of think about finding somewhere in the middle. If you feel like you're sticking your like, if your belly is sticking forward, try to gently tuck the tailbone. Let me see if you guys can see this here. So we want to think about, if I can come all the way forward, that's too far forward. If I come all the way back, that's too far back. We want to find somewhere right in the middle. That is usually your neutral spine where we want to exercise in. I don't want you guys to feel rigid, but I want you to think when you're jump roping, are you flaring your ribs out? What does that do? Look here, if I flare out, where does that pressure go? Increased pressure on my pelvic floor, increased likelihood of leaking. So getting that into a more natural and neutral alignment is a pressure that typically our pelvic region can handle. That's where it's supposed to, and that's where it's working at its best kind of capacity. So making sure when you are jumping or running that we're not really flared out here. That's one of the most common ones. Also, just maintaining good form, good positioning during your exercise can really lead to decreased pressure in your pelvic region. Other common things include you know, like if you are laying down doing like abdominal exercises, a lot of people don't really leak as commonly with these. Typically it's in standing exercises, but if you are, you want to make sure that you're not really arching your back or tucking too far, just really right in that neutral spine. All right, so this is what I was kind of trying not to say before I got to the slide, but a big thing that you might need to do if you're leaking with exercise is scale it back and then build it back up. So what do I mean by that? So say you are doing box jumps and you always leak at like box jump number 3 or 4. A lot of times I recommend that you start with 1 or 2 box jumps, take a rest, and then try it from there and see if you can get to a point where you don't leak. Once you can do that repetitively, so maybe you do 2 box jumps and then you do squats for the other sets until you get your body able to actually not leak. The second that you, about for like a week or so, if you have not experienced leaking, then that's time to add on another rep. And you slowly like to gradually build back up. So some people, they like leak at their 10th jump rope. I usually say if they do 8 jump ropes and then like side to side movements, different sort of modifications until your strength builds up, then we can increase our repetition. So a lot of times it's not that you're never going to be able to do these, but the more you do these reps that are just encouraging leaking, your body is just clearly saying, yo, I don't have the strength to control this. So we're just kind of just facilitating a problem. So if we back it off a little bit to an area where you don't have symptoms, and then we can gradually build up from there, build your strength over time, then you can really not have to worry about leaking with a lot of these exercises. A lot of people don't really want to scale back their exercises. I know it can be frustrating, especially if you're like progressing, feeling strong, but especially the ones that you leak with. is one of the best things that you can do. And there's so many modifications that we can do that still give you that great exercise benefit without causing you to leak. Okay. All right. Do not hold kegels during exercises. All right. That is just basically, I want you guys to think how long you could hold a kegel for. Most people fatigue out around 10, 15 seconds max, and that's like a super, super strong pelvic floor. So holding a Kegel, basically, you're just gonna fatigue out the muscle. It's like holding a like wall squat for your pelvic floor, not gonna work out well. So typically you get fatigued out and then you leak. So you don't wanna do Kegels to hold your Kegels during your exercise. The body should be Kegeling on its own. When we work out our glutes, anything in our core, we're also getting pelvic floor muscle activation. So your pelvic floor muscle should be activating during other exercises and getting strength. So we don't need to do an extra Kegel typically on top of that. One thing that you can do is, say you did like 2 box jumps, you were gonna have leakage, you can rest, then do a Kegel or 2 and return. That can sometimes help some people, but you don't want to try to hold it during your exercise. Okay, so the 3 most common leaky exercises include jump ropes or double unders, box jumps, and running. Those are the 3 most common times people experience stress incontinence or leaking. And these, super, super common, but they should not be happening. I don't care how old you are, if you had babies, etc. We should not ever have leaking with any of these. And if you are, there is so much you can do to help. You are not like doomed. You're not going to leak forever. There is a lot that you can do for this. Okay. Now, let's talk about each one individually. So jump ropes and double unders. So these are some things that you can do to help reduce your likelihood of leaking. Now, you can try quick exhales as you're coming in contact with the ground. So once you land, you trying little exhales that kind of can activate your core and pelvic floor. Remember, we want to be breathing evenly. We do not want to be like holding a Kegel. You can try that. Like we kind of talked about, decrease the reps and then allow for that rest time in between. So maybe you always leak at like 20 jump ropes or like 5 double unders or something. Scale it off, take a rest for like 10 to 30 seconds. 30 seconds would be ideal. That's usually when the chemical processes in the body, we have enough energy for the muscle to work at its best again. 30 seconds is a great time to rest and then try again. That can help, and then slowly build back up. Remember, watch your rib cage position. We don't want to, when we're jumping, be flaring out when we jump. We want to keep a nice core. We can kind of slightly lean forward. That can also help when you're jumping. Also thinking about landing softly and gradually increase the reps. So if you leak at rep number 5, what do? We back off to 4. Do 4, take a rest, try again. If that still causes leaking, do 4, modify, gradually build up over time. Box jumps, kind of similarly, but one thing that you can do, so before you jump, you can take a breath in to relax those pelvic floor muscles, and then begin your exhale right before you leave the ground. So breathe out right as you're about to jump onto the box. That can really help activate core, pelvic floor, reduce the likelihood of leaking. Also, I usually recommend, if you want to box jump up, step down. That can be a little less than jumping back down to kind of high pressure points and then building back up from there. If you modify the height of your box, that might help. Also, like if you find a level that you don't have symptoms, do your box jumps there for a little while and then gradually increase. And then you can increase that height. Soft landing, try not to really like forcefully land. You kind of want to land in that midfoot area for the least amount of forces on your pelvic floor. Running, this is a big one. And honestly, this could be a webinar in its own. There's so much that goes into running. Everybody's running mechanics are different. If you are having leaking with running, like please get a pelvic floor assessment. It's usually very, very specific to you and your body. But you want to ensure that you're having a good midfoot strike and avoid striking with your heel. So this is kind of some like nerdy PT language. So I'm going to break it down a little bit. So you have like 3 parts of your foot. So basically your forefoot is at the front, basically right until the balls of your feet. Your midfoot is basically that space in between that and your heel bone. And then you have your heel bone, which is your heel strike. So you don't want to be when you're running, hitting with your heel. That can lead to a lot of forces that drive up through the pelvic region, leading to leakage. So you really want to think about landing in the middle of your foot. Now, there's a lot of running mechanics. Some people are forefront runners, heel runners. There's a lot of different types of runners. But we want to really think about when we're running, we're not striking with our heel. We're trying to strike more with that midfoot, push off. You can also think about imagining when you're running, pushing off from the back versus trying to bring your leg forward. That kind of shift of that usually typically leads to a better running mechanic. And that can also help with leaking. Why? So without nerding out too much, there are forces when our foot hits the ground that are applied to our body. They're called ground reaction forces. These forces, when they hit on your foot, they travel up your leg through your body. And depending on where your leg hits the ground, it changes the amount of force that's on your pelvis. That's why there's a lot that goes into it. That's why I'm like, we could do a whole webinar. But basically, you might benefit from shortening your stride length, because sometimes when we are stepping way too far out in front of us, that is changing the angle and forces on our pelvic region, leading to leakage. You can, like I said, slightly lean forward, make sure we're not flaring our rib cage out in that neutral spine. Try to just breathe normally while running. Try not to hold your breath. Try not to do kegels. Also for running too, some people, they'll like leak at mile number 1. So I'll have them do like, 3/4 of a mile and then walk, and then try it again, and just go from running to walking until they can slowly, gradually build up from there. Okay, so there's a thing called the neck. This is in general helpful for stress incontinence, which again is leaking with exercise, coughing, laughing, sneezing, anything that there's pressure in the abdomen and then you leak, anything like that. This is a helpful thing. So the knack is actually a reflex that's supposed to happen on its own. A lot of times, whether it's childbirth or just pelvic floor muscle dysfunction, this stops coordinating properly. So your muscles are actually, like I said earlier, they're anticipatory in the pelvic floor, meaning they activate prior to increased pressure, prior to moving. They are constantly, along with your deep core stabilizers, activating prior to movement, prior to activities. So your muscles, before you cough, sneeze, laugh, jump, are supposed to squeeze prior to you doing so. This is subconscious. It's just a coordination naturally of our body. But sometimes that gets a little disrupted. So like I kind of keep relating it back, you could have the strongest pelvic floor muscles in the world, but if you don't have this reflex present, you could be experiencing leaking. A lot of times timing is everything. So it's a squeeze before you sneeze. So one thing that you can do, you don't want to try to hold this squeeze. You want to just activate before you cough, sneeze, laugh, jump. That can really help. I find this really hard to do during some certain exercises, but definitely what's helpful for you to do throughout the day to help your coordination for when you do go to exercise is before you cough, before you laugh, before you sneeze, try to activate down in the pelvic floor, a little kegel, and then sneeze. And then I really want you to make sure that you let it go. We do not want to stay in a kegel. How do I let it go? Remember, deep breath in, diaphragmatic breath. Imagine you're about to start the stream of urine or pass gas, that gentle downward pressure. That's what I want to make sure. You do not want to be holding tension in your pelvic floor. So like I said, your body's supposed to do this neck thing naturally, but sometimes we need to retrain it. So if you do this and other things that increase pressure in your abdomen, it can help correlate to when you are exercising, the muscles actually firing at the right time, because these muscles are supposed to activate in anytime increased intra-abdominal pressure happens, leading to reduced leaking. So you can practice that through your day-to-day activities, and it can really help with leaking with exercise. Okay, now there are these things, I don't know if you guys have heard of them, called Poise Pressas. These can also help with stress incontinence. Some patients I have, they love them. Some patients find them to be really uncomfortable. So they're kind of like a tampon, except what they do is they basically help facilitate pressure in the pelvic floor muscles that surround your urethra to help that closure occur. Some people really find this helpful. I do sometimes think of it as a Band-Aid a little bit to the problem, but it can help. They follow the same rules as tampons. You don't want to leave them in for forever. These are meant for use during exercise and you take them out. I have a picture here of a sizing kit. There are 3 different sizes depending on which one you feel helps you with your leakage the most. But you see here how they have more of a square. So you insert them into the vagina, and that square part places pressure on the urethra and pelvic floor muscles so that you can't really, it helps give your body a little bit of support so that the leakage doesn't happen. Um, like I said, this some people love these. A lot of people I have don't love them. I do feel like they are a little bit of a band-aid, but if it helps give you that confidence, I am all about whatever helps. So these are usually at CVS, Target. You can order them on Amazon. They are the bladder supports. They're called the Impressas. These can be a really good little adjunct to your pelvic floor muscle training. Okay. So all of this said, the best way to know what your body needs is to get a pelvic floor assessment. So yes, we can go through these webinars and they're super helpful for education. And sometimes just that little bit of education can take care of it. But if you are having leaking, you are 99.9% having pelvic floor muscle dysfunction, and you really should do yourself a really good favor and get a pelvic floor muscle assessment. That is the best way to know what you need. Do you need to kegel? Do you need to relax first and really get these muscles doing the right proper things? Remember, most commonly people need to learn to relax. It's really hard to do, and properly be on a training regimen to get back to actually building strength in the pelvic floor. So I really encourage you, if you are having any sort of leakage whatsoever, to reach out to a pelvic floor physical therapist and get a pelvic exam. Now, pelvic floor physical therapy, you want to make sure that you are going to a pelvic floor physical therapist. There are some occupational therapists trained in that, but I would just encourage for physical therapy to see a physical therapist. Their physical therapist should be doing internal and external pelvic exams. They should not be hooking you up to a machine telling you to like squeeze and relax and watch your numbers go up and then like calling it a day. That is not pelvic floor therapy. A lot of times that exists inside like urologist offices and stuff. They'll train a nurse to do it, and that is not pelvic floor therapy. There's a lot more details than just doing kegels. So make sure that you're reaching out to the right provider. I'm very passionate about that because I swear if I hear one more time somebody like was in pelvic floor therapy for a year and they basically just did kegels for a year and got no improvements, I'm like, come on, you guys deserve so much more. Okay. And rant. So I just like to briefly say other symptoms of pelvic floor muscle dysfunction include pelvic or abdominal pain, pain or discomfort during intercourse, leaking, any sort of gas, urine, stool, constipation, painful urination or pain with bowel movements, any prolapse or heaviness, overactive bladder. If you have back pain and hip pain that's been nagging you and you've done all these things in therapy and nothing's helped, likely your pelvic floor muscles are involved, tailbone pain, and many, many more things. So a lot of times these things go hand in hand. A lot of times stress incontinence is not the only symptom somebody is having. So there are a lot of other things that you can have help for. Okay, before we get to questions though, I do want to just give a quick shout out to Dr. Sean Greenan and Sandbar Athletics. They are the ones who helped set up this awesome webinar and topic. And if you don't know, if you're local and you don't know Sean and you don't know about their wonderful gym that they have, I definitely encourage you to look out for them. Sean is an acupuncture physician, also getting trained in functional medicine. She's wonderful and just a wealth of knowledge. Really encourage you guys to connect with her. Also, she's a part owner in the Sandbar Athletics, which is a awesome gym and exercise facility. They are so great and have been just a great collaboration with us. And I really encourage you guys to check them out. And thanks to them for helping set this all up. Really appreciate it. Okay, so what questions do you guys have? I just blabbed for like 40 minutes. Oh my God. So we have like a few minutes, probably like, I'm not going to bore you guys for much longer, but if you do have any specific questions, go ahead and put them in the chat box. You can message me directly, or you can send it to the whole group. We can do a little live Q&A here. No worries if there's no questions. Thanks, Becky. I'm glad you found it helpful. Yes, I will get to how you can contact me in just a moment. Oh, Sean, let me unmute you. Hold on one second. How do I do this? I'm like a Martian. Okay. Hold on one second, Sean. I'm trying to find. I do not know. There we go. I'll let you unmute, Sean.
Okay, can you hear me?
Yeah, sorry. I was like, I had you guys all hidden, and that's I couldn't figure out how to bring it back.
First, I was going to say thank you so much for doing this. This is such a big, important topic, and especially in a
Yes.
gym. We talk about this a lot. I like this to be an open conversation. So I wanted to say if there's anybody here who does go to our gym, we are going to be incorporating some of this and being aware of this. So don't be afraid to ask us in the gym, hey, I need to throttle it back for your sake. And I highly encourage you to go see Dr. Kat. She's amazing.
Oh, thank you.
Yeah, but if you're working with us, and I'm going to talk to Coach D for the morning classes as well, and he's going to be well aware of this. So don't ever think we're going to push you past this limit, because your pelvic floor health is so important. That's why we wanted to get this set up with her, so you can have these options.
Yes, absolutely. And sometimes it's like it's really hard to talk about. And it's people, or they just like, oh, I just worked out really good, I leak. And it's not, and sometimes it's like might be really strong and you can handle like those loads. It's just you might need to mess with your posture, you might need to mess with your positioning, or just scale it back and build back up, or possibly reduce breath holding, all the stuff that we talked about. So there's a lot that you can do. You are not broken if you're leaking with any sort of exercise, or you're not really harming, like doing all this damage. It does not need to be happening.
Absolutely. So thank you so much for setting us up.
Yeah, of course. Thank you. I'm just so grateful to have you guys, and just so grateful for all that you guys do. So awesome. Any other questions? I won't keep you guys on too much longer, but if you would like to contact me, I'd like to give you just my information. You can find me on Instagram, on Google. You can call this number. However you want to get in contact, that is great. If you do feel like you even want to know if pelvic floor therapy is for you, you can just ask me. I'm happy to talk through it with you and be like, yeah, no, you probably don't need pelvic PT, or maybe you do. We see people all different witches and ways. If you're not local to Melbourne, I do online consults as well. And yeah, so that is helpful. Also, you can look up a lot of times. We can look up Sean and Sandbar Athletics too. If you have any interest in connecting with them, I highly suggest you do so. And Sean, will you put your contact info in the chat? Anyone can have it. But if you do have friends that did not join or couldn't join tonight or anything, I do repost these replays on our YouTube channel. So they're welcome to watch it, learn and on their own pace, or you can rewatch this, because I know we went over a lot. It can be a little bit, a lot to take in at once. So if you can rewatch it, if you are really feeling encouraged. But yeah, so it was so great. Sean's going to put that in the box there for you guys, and then we will go ahead and conclude tonight. Perfect. Yep. So sandbarathletics.com, or the Wellness Boost is Sean's acupuncture business. So wonderful in our community. So grateful. Thank you so much, guys. Thanks for joining. And we will be doing these live webinars more in the next coming weeks or so. So let us know if you have any topics you want us to cover. Would love to do some. Have a great night. All right. Bye, guys. Thanks so much.